planning, financing, planning, design, and related services. Director.
Good afternoon. So today we are asking for the ability to exercise the first option on the Pasley Management Group contract. They provide support through, so far in year one, through all the planning efforts that have taken place related to the upcoming Terminal Modernization Development Program. They serve as executive program manager for that program, supporting us. Funding for year two of their services was included among a list of enabling projects in the $175 million approved by the signatory airlines at the start of the year. There are a number of major tasks that have been either completed or are currently in the works since Pasley began supporting our efforts last fall. And those include an overview or sort of a deep dive analysis of our master plan document to determine its current applicability to conditions, as things have changed quite a bit since the COVID-19 pandemic and the demand of services and activity levels at airports. There's an ongoing process regarding recommended revisions to the portion of the document that focuses on passenger forecasts and terminal facility requirements. They're also performing some stakeholder engagement and data gathering on our behalf, looking into program staffing requirements for us, looking into the program management information system, and that we're going to need the analysis of all those services that are available, recommendations, and ultimate purchase. The enabling projects, again, that's the $175 million that the airlines approved earlier this year. They're also looking into the scope development of those projects and a list of other support services that are all geared towards moving us further down the path towards actual development of the Terminal Modernization Program. So we ask for your approval of this first option to the agreement with Pasley Management Services. Thank you.
Thank you. This was heard in Transportation and Mobility. Councilman McCormick.
Thank you, Mr. Chairman. We did hear this in Transportation and Mobility. It was approved unanimously out of committee. As the director noted, this is the request to exercise the first option. So we've already approved this contract through City Council the previous year. Once again, this is paid for through the airport system, through the airlines. So general tax dollars do not go into this fund. And again, as we embark on a massive, large-scale plan over the next 10 years, having these services embedded within the airport system is critically important. So good conversation at committee, Chairman, and at the end we approved it unanimously.
All right, thank you. Do we have any questions regarding ordinance number 937-2024? Seeing no other questions, ordinance number 937-2024 stands approved. Please sign off. Next is ordinance number 944-2024 by Council Members McCormick and Griffin. By departmental request, an emergency ordinance authorizing the purchase by one or more requirement contracts of labor and materials necessary to remove rubber and any other contaminants from paved surfaces for the various divisions of the Department of Port Control for a period of 2 years, with 2 one-year options to renew, exercisable by the Director of Port Control. Director.
Yes, this item is requesting the ability to go out for services related to rubber removal from the runway surfaces. So rubber from landing aircraft builds up on runway surfaces and must be removed for optimal pavement conditions. The airport's required to monitor the accumulation of rubber buildup on the runways and to have it removed when necessary. The FAA requires this action based on the amount of runway operations each month. We have equipment in our inventory to survey the runway rubber buildup and perform that function monthly. However, we do not own the equipment that actually removes the rubber, as it would be rather costly and also is not needed very often, typically just a couple of times per year. These services also include the removal of paint markings. We're required to remove excess paint buildup when necessary prior to applying new paint, so that's also a part of these services. We are looking to have this budgeted at about $100,000 annually, and it will be a 2-year initial term with 2 one-year options to renew, and we request approval.
Thank you. This was heard in Transportation Mobility. Councilman McCormick.
Thank you, Mr. Chairman. When planes hit the runway, they leave rubber with them. So this is a necessary service to remove the rubber. A question was asked at committee about purchasing the equipment. Director noted that it'd be far more expensive to purchase than to lease, given the infrequency of this service at the airport. But infrequent but critical to remove tire rubber off the runway, sir. This was approved by our committee.
Thank you. Just briefly, just some institutional knowledge. Does this interfere with any kind of runoff? Because I know that we had challenges with potential runoff for some of these chemicals and other things into the nearby brook. Does it have any impact on that?
I might ask Assistant Director of Development, Mr. Kramer, to respond to that.
Mr. Chairman, no, this particular operation does not affect any kind of stormwater runoff or have any kind of environmental impact.
Okay. All right. Thank you. Any other questions regarding ordinance number 944-2024? Seeing no other questions, ordinance number 944-2024 stands approved. Please sign on.
Thank you.
Thank you. We'll bring up
Thank you.
economic development. This is ordinance number 1014-2024 by council members Casey, Hairston, and Griffin by departmental request, an emergency ordinance authorizing the Director of Economic Development to enter into a loan agreement with Neighborhood Healthcare Incorporated or its designee to provide economic development assistance to partially finance the redevelopment of property located at 13027 Lorraine needed to expand their operations and for other associated costs necessary to redevelop the property. Director?
Thank you, Council President, members of the committee. I am joined here today by Dominic Hobson, the President and CEO of Neighborhood Family Practice, as well as Kevin Schmatzer from our department, who has been working through this. And we're here today to discuss with you a $500,000 loan that will be put in place to help Neighborhood Family Practice take over a vacant former CVS pharmacy and move into the neighborhood. This would be in addition to a $50,000 neighborhood development planning grant that we expended to Neighborhood Family Practice in May of this year. And I'd like to hand it over to Mr. Hobson to talk a little bit about their project before we move forward.
Good afternoon. This is a site that we are very excited about. It'll allow us to expand our operation, adding additional primary care, behavioral health, dental, and pharmacy services. As we know, the closures of pharmacies across our community has been significant, especially this community. They've lost 3 pharmacies in the last 3 years, so we will be bringing back a drive-up pharmacy to this neighborhood, and it's a neighborhood where we see a number of our refugee and newcomer population, many of them that walk to our facilities. We are moving from West 117th in Lorraine, and one of the reasons that we chose this site is because it is less than a mile. I think it's about 0.6 miles from our current location, allowing us to continue to serve the people who have been relying on us for a number of years, while also expanding our capacity and all the services that we provide out of this site.
So I would also like to add again, this is a $500,000 loan. It is a 10-year repayment term. It is 3% interest. I would also note that this is made possible because there has been $419,000 ARPA grant that was put into this. So there were county put an ARPA grant into it. There are a lot of people that have come together to help make this a reality. We think that this is a critical investment for this neighborhood. This is also a situation where by their ability to expand, there will be approximately a creation of 13 full-time employment jobs as a part of this, with an additional payroll of $1.583 million into it, creating an additional new annual income tax of $58,658 annually.
Thank you. Mr. Schmatzer, anything to add?
The Council President, City Council, no, I think we did a presentation last week on this. Neighborhood Family Practice is a great institution. They've been around since 1980. The services they provide to the community, including immigrant services, HIV, AIDS services there, bilingual staff. I could just go on and on and on, which was in the presentation last week about this great organization.
All right, thank you. I do agree, neighborhood family practice is stepping in, filling a void where a lot of other people, quite frankly, are abandoning the city. I think that, filling some of those CVS, I hope that we're doing a landscape analysis to see where we need these kind of drugstores. I know that I spent a lot of time in Councilman Polensik's ward, and I had to get an earful this weekend from the seniors in that area because of all of the different stores that have left that area. My residents have to go way out to Shaker now. I know that there's a task force that Councilwoman Gray is representing us on, but I hope we're looking at strategically where these locations can go to continue to serve our community, because we got to go back to mom and pops. The corporate community and many of these corporations, these national chains, have totally abandoned the city with grocery stores, prescription drugs, and everything else. As far as I'm concerned, I only want to deal with a neighborhood family practice instead of some of these other folks that just abandon us whenever they can't make profit. So thank you, guys. This looks good, and I like the idea of what you guys are trying to do, Mr. Hobson. I have Mr. McCormick and then Mr. Polensek.
Chair, thank you. I'll be brief because we spoke quite a bit about this at the Development Committee. I want to congratulate CEO Hobson, who's here with us today. And as I noted when I first came on, when he first came here to Cleveland from Cincinnati, is that where you were before? Yeah. He called me right away, Chair, and said, listen, we got this Tremont Clinic. It's in your ward. I want you to come out and learn about what we're doing. So I appreciate that and our communication since. Neighborhood Family Practice is a wonderful institution here in Cleveland. And Chair, I just really want to echo what you said and put an exclamation point on it. I think as we look at pharmacies and grocery stores, I think it's worth the investment to look at how do we put real dollars behind people like NFP to open in areas that are sustainable for them. We don't want them to close 2 years later, so that makes sense to them. But to me, that's worth the investment. So this is a home run. There was a pharmacy there before. This is going to be a health center and drive-up pharmacy. So that pharmacy services are going to be reinstated in the neighborhood where they were taken out by a corporation. This is a home run, Chair. And so my question is not, do I support this? I support this wholeheartedly. My question is, how do we, as you noted, Chair, continue this conversation in different parts of the city with a trusted partner, but then on our end, putting money behind it, putting real money behind it to make it make sense for them or others. But you're in front of us today, and you're a great partner to open throughout the city of Cleveland. So, and I would say, Chair, I know that there are folks thinking about grocery stores. I don't even mean in the city, in a different way. I know folks at Metro Health and some other folks are thinking about, is there a way to create an opportunity for more nonprofit-based grocery stores that can go. The point is that we've got to be innovative here, and this is a great example of a win in the city of Cleveland, Mr. Chair.
Absolutely. Thank you, Councilman. Councilman Mike Polensek.
Thank you. Thank you, Mr. Chairman, honorable colleagues, and to the representative of the administration and the health clinic. I wanted to follow up on the council president's comments. I've been around here a long time, and in the day, in the city, we had what I call those mom and pop pharmacies in our neighborhoods. In fact, I was thinking about them that were all over the northeast side of the city, Glenville, Collinwood areas, et cetera. And then the chains came in. Before the Walgreens and CVS's and what else am I missing here? Rite Aids. There was the Gray drugstores. And I'm trying to think of the other chain that was around as well. Yeah. And I think of all those, I think like down Superior, down St. Clair, I think of all these stores. And and again, as the council president indicated, we just lost the Rite Aid on 185th at Lakeshore Boulevard, which was a relatively new store. And just right there on the border of us and Euclid. And then we lost the Walgreens on Lakeshore Boulevard. And I told them when they closed the big store and went to this micro operation that I didn't think it was going to work, because if I go in a drugstore, conventional drugstore, 9 times out of 10, I'm coming out with something else. I'm just not going in to get a prescription. And I said to them, how do you think how is that going to work? Just going in for a prescription. And then you can never figure out when it was open. It was just a poorly run operation. So obviously that's closed and now that property's up for sale. So, you know, this is something, and I see what my other colleagues have been going through. I see what my colleague Danny Kelly's been going through, trying to do the right thing for his neighborhood over there, try to bring development into his neighborhood and others. But I think there comes a point where, is there, and I say this, is there any type of state or federal, especially through the Department of Health, where grants or financial assistance can be obtained so we can underwrite the operation of drugstores once again in our neighborhood? Because I'm of the opinion that a drugstore by itself is not going to survive. It has to be linked to something else. It's got to be linked to a grocery store. It's got to be linked to something else, because if it's just a standalone pharmacy, it ain't going to work. So I'm trying to figure, that's my observation. I'd like to hear someone's comment. But I'm trying to think, what federal grants are available in light of, we can't be the only urban area that's experiencing this, especially in Ohio, because we're seeing all these places closing. And as I'm sitting this morning looking at my phone, I just saw this announcement this morning of a bunch of banks that are going to be closing their standalone operations, their branches. I couldn't believe what I'm looking at. All these banks that are being closed in branches, and that's going to be the next round impacting our neighborhoods now. And some neighborhoods don't even have a bank left in them, a bank that you can walk in the door at. So I'm just trying to think, what, if any, federal or state assistance, because I'm of the opinion that the city can't do it alone. We don't have the financial resources to do it alone. And I applaud this applicant for coming in and making a commitment to the community. But I'm racking my brain, as all of us are. What can we do? What can we do different here? Who can we reach out to so we can start to attract, or we can convince somebody to partner with a pharmacy, with their business, whatever that business may be? I don't know. I'm tired of looking at empty stores. I'm tired of hearing these corporate guys saying, well, you know, we're out of here, we're bailing, because they have no commitment to our neighborhoods. And yet we are all there to help them to come in when they needed zoning variances. When I think of those stores that came in my own community over the years, every one of them needed city assistance, variances or this or that, and we're all there to help them. And then, boom, no loyalty. They just blew out of our neighborhoods and left empty buildings sitting there, and in many cases not being maintained. So again, any comments along those lines? Any federal assistance available?
Rector?
So through the chairperson and the councilperson, as the council president mentioned, there is currently a task force that Councilwoman Gray is sitting on, where we are kind of looking at two different sides
Yes.
of this. One of which is, how do we ensure that our seniors and residents get the prescription
Right.
needs met? And that is critically important. The other portion on this is the real estate aspect of it, and how can we reutilize these properties that are kind of left behind. I think, as pointed out, and I would like to thank CEO Hobson for their organization's commitment to this. They have gone through a lot to get here today. The reason that we are supplying this $500,000 loan is because costs kind of exploded towards the end of this. This was not an easy lift to get there, and it took a lot of additional sources
Okay.
to come together. By my calculation, there are over $960,000 in a variety of different types of grants that help make this capital stack work.
Okay.
Some of those are one-time funds like ARPA. Right? So I don't think that this model is necessarily easily replicable today, but that is exactly why we have a task force that is kind of cross-departmental, working alongside council to see what are those sources. Because I agree, it's going to take a lot of innovation to figure out how to get there. What I will say is that I do believe that this is a model with an amazing community partner that does extraordinary work, right? Where we're repurposing this old store where there is now going to be a pharmacy in there again. I was joking the other day that this is actually one of the few uses that makes a CVS look nice, right? That comes in, so it's a great fit. But from a financial perspective, it's really hard to make work, and so we do need to find a way to get innovative.
Okay. And the last comment, Mr. Chairman, to make, the people I talk to in the real estate community, they're telling me, whether, I don't know if this is going to be correct or not, that at the end of the day, it looks like the only drugstore type, or what we look, the classic drugstore that sells other things besides prescriptions, that is going to survive this, this economic storm that we're seeing is Drug Mart. So what are we doing to try to attract drug marts to back or into the city of Cleveland? I don't know if there's any drug marts in the city at all. I'm not aware. I see them in the suburbs. Is there?
Only a couple.
Yeah. So what do we do? Because that's a family-owned business, Drug
Yes.
Mart.
Yes.
So what do we do maybe to reach out to them to try to get them to expand their footprint in the city as well? That's all I have to say, Mr. Chairman.
And to Council President, to the councilman, they are on my list to talk to. I know Councilwoman Spencer has reached out to them as well.
Yeah.
Over there. But again, I think we are looking at broadly, how do we kind of find a solution to this?
Okay.
As you mentioned, this is kind of a national problem, right?
Correct.
This is not unique to Cleveland.
Right.
This is not even unique to urbanized areas, right?
Yeah.
You know, this is, you look at Amazon doing direct-to-home prescription sales, like all those kinds of things. This is a large-scale problem, and we are trying to get as creative as we can.
Okay, thank you.
Yes, sir.
All right. Are there any other questions regarding ordinance number 1014-2024? Councilwoman Spencer?
No, I was just gonna say, I mean,
Uh,
I'm here on behalf
Council-
of Hairston.
Councilwoman Santana?
No, I'm here on behalf of
Okay.
Hairston, because, you know, I was just gonna say, we fully vetted the piece, and everyone unanimously, you know, agreed, and they're very excited for Ward 16. And I will let you know that because of our ARPA dollars that went to the Blinken Mills, they're actually opening a healthcare center in Ward 14 off of Fulton Avenue, so we're just excited about it. Okay, so go
Thank
ahead.
you. Thank you so
One
much,
dominant.
Councilwoman Spencer.
Thank you, Mr. Chair. Just one brief question I wanted to clarify from following up from last week through the chair to Mr. Hobson. Is the pharmacy going to be only for NFP patients, or is it open to the open to the public?
All right, through the council, to the chairperson, to the council member, we are still exploring that. Most of the pharmacies that we operate are closed pharmacies, primarily because we operate a 340B pharmacy, which means we buy our prescriptions at a reduced cost, and then we pass those savings on to our patients. The federal rules say that we can't sell those same drugs to a non-patient. So we would have to duplicate our inventory, in essence, buy 2 sets of inventory for each drug, which has a lot of compliance issues. There are some organizations that do it and do it well, but it is a compliance nightmare in some cases, but it's not off of the table.
That is a fascinating response. There's always more to things than one would imagine. But in any case, I know that I'll just echo what's been said, and Councilman Casey is just so thrilled to have this in Ward 16, and we're all glad to see it. Thank you.
Great, thank you. Councilman Kevin Conwell.
Thank you. We do have a fact. We lost Rite Aid in the community. We have 2 more pharmacies. One is Neon on 123rd and Superior, but it's a closed pharmacy. And we have a private pharmacy, Councilmember Mike Polensek, on 105 in St. Clair. I forgot the name of the pharmacy, but it's in the Glenville Town Center, right across the street from the East Side Market. But the thing with pharmacies with, what's the name? Different, I'm trying to think of this. Who do we go online? And with Amazon, they're doing pharmacy in other places, and it's becoming a threat to the regular pharmacies like Walgreens, CVS, because they're delivering to residents, to people in the city. When they start delivering, it's cutting into it. It's cutting into it, and it's very, very competitive. So some pharmacy places are not making money and they're closing. But the pharmacies, when we didn't have that, Rite Aid and Walgreens, the main moneymaker for any business was pharmaceutical, more so than the groceries that was in Rite Aid's. Rite Aid groceries, I mean, with the shrinkage or whatever, it's not competitive as the pharmacies. So it's those pharmacies that's making the money. You could get rid of the food, and you could really do it, Councilmember Mike Polensek, a standalone pharmacy. Walgreens, matter of fact, they're starting to do that. And they closed their Walgreens in East Cleveland a few months ago, and they just have a pharmaceutical Walgreens. Just making money, you just got to control your cost of labor and your advertisement dollars and all those kind of things. But people are going there. There's a trend that's starting to change, and now we have pharmacy deserts throughout the city of Cleveland. But we have to figure out a way to handle that and to deal with that. But it's coming, and I don't want to wait until it get here. But you might see, I think Walgreens is kind of strong because they're related to Sam Walmart, and it's the same as when you go to Sam's Club or whatever, it's in that same family with Sam's Club. So their stock is pretty strong, but CVS might go the way of Rite Aid. And so we have to pay attention to that and try to get in front of it. And that's what I'm looking at right now. Thank you.
Thank you, Councilman. Very valid, good points. You know, we just lost the Rite Aid at Chester and 101st.
Right. But
So,
you know what,
yeah.
Mr. President? There's a shortage of pharmacists also.
Yeah.
In the hospitals like University Hospital, as well as Cleveland Clinic, they are pulling pharmacists from places like CVS and the other stores. And it's a battle. You know, it's all supply and demand. Thank you.
Thank you. Just to let you know, we also have been reaching out to the clinic and others about this, but just to stay on that point, and the councilman brings up a very good point. How will you remain competitive when people will start moving towards drone drops and other things as far as pharmaceuticals?
To the chairperson, we are also delivering pharmacies ourselves. So we have a delivery vehicle and a delivery driver, and we're now also mailing prescriptions across, because we're delivering to about 12 zip codes and then mailing across outside of that. But the point that the councilman made earlier is that our pharmacies are integrated with our larger business plan. We believe that we provide the highest quality primary care in our region, and when you add that with intentional, strong pharmacists that is educating our patients around what those prescriptions are and how they interact with other meds they're taking, it's a different approach, and we're looking at the overall cost of care for our patients and looking at how do we provide value. So it's not a standalone option that is as risky of a proposition for us as it is for some of those other organizations.
Outstanding. Okay. Thank you. Seeing no other questions, ordinance number 1014-2024 stands approved. Please sign on. Thank you, guys. Congratulations. Keep up the good work. Thank you. All right, this last one is ordinance number 1051-2024 by Councilmember Griffin by departmental request. An emergency ordinance authorizing the Director of Human Resources to enter into one or more contracts with MDX Medical LLC, DBA, Sapphire Digital, a zealous company, to obtain a subscription or license to use the Smart Shopper program for city employees as part of employee health insurance benefits for the Department of Resources for a period of 1 year with 3 one-year options to renew, exercisable by the Director of Human Resources. Director Cole.
Thank you, Chairman and Committee. So when I first started with this city, one of my charges, and I think I had expressed it, gosh, now a while back, was to work on the reduction of claims cost for the city related to health care. This program is in part an attempt to do that. It's an incentive program that works with our healthcare programs, Medical Mutual and Anthem, to offer incentives to employees to obtain their health care at select locations. In turn, they receive an incentive to do that. And then the other side of it is that the claim for the city of Cleveland goes down because the claim's at a reduced cost. So just some highlights, just to kind of explain it a little bit better. they already, as I mentioned, they already work with our plans, MMO and Anthem. The program covers anything from routine imaging, MRIs, CAT scans, those types of things, all the way up to and including surgeries. So the cost savings can actually be pretty large. In turn, the employee, again, is rewarded through an incentive to go to a particular location, doctor, to get the service. And then we are rewarded in a way that the claim is, in many cases, far less than it would be if they just went to who they wanted to go to. It is voluntary, so it's not something that an employee has to do. It's just an incentive program. So some other highlights I wanted to cover. Basically, the way that it's done is through a platform. An employee can go online to this platform. It's a website, Smart Shopper. There's actually an app for it as well. Just to kind of walk you through an example, I need an MRI for an ailing back. I go onto the app. I go through the list of providers that are in our network. I see that there's a location, that's maybe 10 miles from where I live, which is a little farther than I prefer to go, so to speak. The incentive to me to go to that particular location is, let's say, $50. The claim, though, on the other side is going to be, in some cases, far less to the city than it would have been if I'd gone to who I wanted to go to originally, let's say, 5 miles from my house. So I, as an employee, am given a $50 incentive to go to this particular location for this MRI, and then in turn, the cost is reduced when it's billed on the other side. In many cases, these are new installations, a new practice of doctors that's just trying to get, their feet off the ground within the network, a new imaging center, a new bariatric center. There's lots of examples that I could give. Just a little bit of reference related to some of the cost savings or potential cost savings. Or before I go there, the incentive to the employee to go to a particular location to have something done can range from $25 to $750. So you're talking anything from just a plain, let's say, imaging all the way up to and including a more complex surgery. When we had Smart Shopper analyze our data along with Oswald, who's our consultant for healthcare, they looked at our claims from a period of February 1st to January 24th, February 1st of 23 to January 24th of 24. Through MMO, if our employees had utilized the Smart Shopper platform, could have resulted in claim savings of over $5 million. Now, this is the assumption that every employee used the service for every possible, procedure that they could have undergone. Anthem was approximately $2.5 million for the same time period. So these were things that included colonoscopies, CTs, surgery, cardiac procedures, gastrointestinal procedures, MRI, bariatric surgery, and the list goes on. So as it ties to the claims reduction, as I'd mentioned earlier, this is a program that could act to reduce claims. But on the employee side as well, I think it's really, really important that this also both empowers and really looks to have employees take some control of their own health care. For instance, preventative care, mammograms, those types of things, colonoscopies. If you can reward an employee for preventative care, right, and at the same time reduce costs, it's kind of a win-win. So It is for asking for a period of 1 year with 3 one-year renewals. It is the cost to the city in terms of implementing the program is nothing. However, we do pay $1.50 per month per employee charge. So it equates to about $130,000 annually. And then the cost of the incentives. So approximately, we're approximating at about no more than or not to exceed $170,000 annually. But the data shows that it can just reap not only of the cost of the program back, but much, much more exponentially as time goes on and the program becomes more and more implemented. So I think that probably given you maybe more than you wanted, but I'm certainly open to any questions that you may have.
Thank you. Before I turn it over to any questions, let me make sure I double check and I understand this. So I need a MRI or colonoscopy, and the first available opening is in Stowe. Not close to the house, but I'm going to travel to Stowe, so I'll get a $50 or so discount for going ahead and taking that appointment. Is that sort of what you're saying, or what?
Well, to the chair, it's a little bit more than that. So I'm looking for a colonoscopy on the platform, and it gives me a whole list of available options. It could be from anywhere from 2 miles from my house to 25 miles from my house. And then depending upon the reward, it could vary through any of those installations. So it could go, the same colonoscopy 2 miles from me could be $50. If I'm willing to go 10 miles, it could be, $100. I could go 2 miles, it'd be $25. It's not dependent upon the distance from your house. It's more dependent upon what's available, the locations that are available, and with the incentive that is being offered.
But thank you. Let me tie it together, and I may be reaching, but my experience, whenever I have one of those specialty care needs, is a lot harder to get an appointment in some of the areas that are in the city for various reasons. Then you have other barriers like parking, traffic, other things. When you got suburban communities where a lot of times you can get right in, parking is available, and you're paying the same cost. What I don't want to put us in, we just now talked about proximity and making sure that our community has proximity to care.
Sure.
I don't want to put us in a position where our community doesn't have good proximity to care because we're trying to get a deal. But I might be reading a little bit more into this than most people, but you'll be surprised how far they'll send you for some of these preventative treatments. And that's just my experience, but I think I made my case, but we'll go from there. I have Councilwoman Santana and Councilman McCormick.
Thank you, Mr. Chair. And on that point, you're onto something. I think one of the things that I worry about is, one, my chart, or, they sink in all of the results. And from when I worked at Metro Health, when there's a doctor that doesn't have access to my chart, they don't know the history of that patient. So are we sending patients to a specialty care that is not connecting to a primary care? And so, and I know that could lead to some healthcare outcomes. So that's one of the things I worry about. Second thing, could we manage through the chair to the director what facilities they go to? Like, we would love to push people more to Metro, neighborhood family practice. I'm worried about taking our employees out of our local healthcare institutions and sending them out to a suburb facility that is a private care. So taking away from our local healthcare management system. So that's two. The third one, which I don't understand, is we're paying $170 for a platform that's going to manage that. Can you just clarify that? We're paying $170, but we're saving $5 million in claims. Is that the trade-off?
So through the chair to the councilwoman, so taking these by step. So these providers are connected to our plans. So this is not a situation where we're pulling them out of our networks,
Okay.
for instance, and sending them to a private provider. This is a situation where they're actually connected to MMO and Anthem both. So that's already vetted out. So to your point regarding like my chart, right, the chances that it's going to be a provider through MMO, so it'll be in my chart. It's and also it's not to pull people away from care within the city. It just gives them options. It may pay a $25 incentive for an MRI at Metro, and it may pay them $50 for the same MRI at Cleveland Clinic main campus. It may pay them $25 for Stowe. It just depends upon, they're basically trying to draw in patients for a variety of reasons. It could be just a new Metro facility. It could be a new University Hospitals facility or a Cleveland Clinic facility they're trying to get patients to. It's not an attempt to pull them away from who they want to go to, and it's completely voluntary. So it's not something they have to do. It's just an incentive for something they could do, and they're incentivized as well as the city's incentivized because the claims will go down. So to your last point regarding the cost, so for plans like this, there's a per employee per month cost. We figure there's about 7,300 covered lives, so to speak, in terms of City of Cleveland employees, which equates to $1.50 a month each comes out to be about $130,000 or so. And then the additional money for the first part of the contract is the incentive. So that's actually what we would pay the employees in the incentive to go. But just to stress, this is in no way to pull them in any direction. It's completely voluntary. If someone wants to do it, they can do it. We would encourage them, right, because they can get the same service sometimes at a brand new facility somewhere, even if it's within the city of Cleveland, to go there because they're looking to get patients, and then our claim on the other side is reduced, sometimes substantially.
So through the chair to the director, I guess, did you do a pro forma of what's our return on our investment for the 170?
Yeah, so they do have through the chair to the council, they do have a guarantee of a return on investment of $124,000 by the third year. But looking at our data, when Oswald looked at our data along with Zealous, that's where they were able to draw what we could have had based upon our claims in just a 1-year period if people had actually used the Smart Shopper program. Not to mention they would have been incentivized. So if I know I'm going to have a knee surgery, right, and my knee surgery is, I go to the clinic versus, my normal place or a different clinic location versus main campus where I prefer to go, I can get $500 to get my knee surgery at that other clinic installation, and then the city receives a far less bill at the end, right, in the form of the claim, because we're still self-payers. So it's not to draw, it's not to draw people's decisions for them. It's actually more to help empower them and then reward them for empowering their own healthcare decisions.
Got it. Okay. Like I said, I would just worry if I have a mammogram scheduled and I could save $50 in a different county, another city, then I'm going to drive up there, and then that money, it takes away from Metro Health or local healthcare institution. So that's the only thing that I would be leery on. Okay, to the chair. Thank you.
Thank you. Very good points. I have Councilman McCormick, and then do I have Councilman Pulisic? No. Okay, Councilman McCormick.
Thank you, Chair. Chair to the Director. So
Yes.
in your testimony, you noted that this is generally kind of considering newer clinics, newer practices. Is that correct?
Through the chair to the councilman, it could, yes.
Yeah, so in the challenge there, Chair to the Director, a lot of those we see are in Avon Lake and Medina County and Jaga County and Chardon and things like that. So I understand the intent of the plan is not to pull people out, but intent's irrelevant. What's actually going to happen? What is what is this going to do, to Councilwoman Santana's point, if Metro Health, and let's use the same system, I know that they have hospitals in different parts of the county. If a bunch of people stop going to main campus because a newer hospital, I think they've one in Twinsburg or something, start to go there because they're incentivized, and Metro says, okay, our mammogram services are down 50% at main campus, we're going to shift employees and resources to Twinsburg because that's where we're seeing more mammograms because people are being incented to go there. Same thing with the Cleveland Clinic and otherwise. So I guess, what guarantees do we have that that won't happen, or do we not?
Through the chair to Councilman McCormick, I don't think we would have guarantees like that. I can tell you from my experience with this program that I had implemented with the state, I didn't see that. And just a quick note too, this is not to replace an employee's primary. It's not to pull them away from where they normally go for care. It's more for a select set of services that many of which are preventative or routine in nature, in which are still within the same system and required for an employee's health. But it incentivizes them to switch not to switch a location, but I could have 10 locations to pick from a particular service, and it's up to me if I want to take any one of those 10.
Thank you.
If not, I could just go to where I normally go.
And then Chair to the, obviously I should have said at the beginning, 5 seconds of soapbox. Our healthcare system nationally is so ridiculous that we have to have this conversation. We should have a public healthcare system that serves everybody. I'll leave that there. But so I guess the challenge in my mind is, if this is dollars motivated, not care or location motivated, why wouldn't we get to a point where it would say a primary care physician in Avon Lake is cheaper than the one I'm seeing at Lutheran Hospital, we'll give you $100 to go there. Is there anything in the contract or law that prevents that?
Through the chair to the councilman, no, but it's not primary driven.
Today.
So, well, the program is not intended for that.
No, I understand that, but
yeah.
I'm trying to work past intentions into what actually happens on the ground. My concern here is that with a approach that is just simply dollars-based, the councilwoman, articulated it perfectly. If we're starting to push, because it's not going to, if it is simply market-based, it's not going to care about the city of Cleveland. It's not going to care about our city.
Right.
It's going to say, cheapest option is in Medina. Here's $100 to go to Medina. And our employee might say, great, I was going to go to Lutheran Hospital or Metro Health. I'm going to Medina now because I need that $100. So it's not going to care inherently about our city. There's no guarantees that it won't push people out of our city, where we just got off a piece talking about deserts of pharmacies and grocery stores in our city. Mr. President, I think I'm a no on this one. I'm not comfortable with this at all.
Yeah, I think what we need to do, Director, because there's a lot more questions on this, and I would really like to just vet this some more and bring it back if I could.
Sure.
I think all of us have some questions because we just talked about proximity, and this kind of, I think Councilman McCormick, Councilwoman Santana said it very articulately. It kind of puts us in a situation, if it's market-driven, it takes away proximity. That's always what people would do, and that's what I'm concerned about.
And Chair, if I can just clarify on that too, you might be able to get the same high-quality service at Metro Health main campus, but if there is a newer hospital that's looking to up their numbers, even though you can get that high-quality service at Metro Health main campus, they're going to send you over there because they're incentivized to get new patients. So they may have a lower claim because they're looking to build a patient base versus legacy hospitals in the city of Cleveland. And this is just, I understand the finances of it, and I'm very sensitive to that. We look at the budget every year. And I appreciate you bringing this forward because we do need to be looking at everything we can to make sure we're efficient. I'm concerned about some significant effects it could have on our provision and availability of healthcare services in the city.
Yeah,
That's-
and Director Cole, what I would like to do if we could, and I'll hear a response from you, but I think this would be good if we could hold this until we get more answer, because I think Councilwoman Santana brings up a good point too. I'd like to understand what some of our local healthcare providers understand that. And I also see we have Dr. Margolis here. I would like to maybe understand what he thinks and what his recommendation about it. I always want to save money. I love saving money, but I also don't want to inadvertently, notice I said inadvertently because I don't think that's your intent, but I don't want to inadvertently run into the issues that my colleagues just brought up. And I just want to see if, I know you probably took some notes, but if you could allay our concerns a little bit on that, I think, and come back, I think we'll look at that again. If we could. Fair
Sure.
enough?
Sure, and I guess I would just like to add, one last thing. This isn't all about money. The care side of it is, I don't think maybe getting across. If a mammogram is an example, or a colonoscopy, the encouragement is for an employee to get those, right? And in many cases we see, and we see here at the city as well, people wait too long. If you incentivize the care to some extent, whether it's at Metro or it's in Avon Lake, to your point, it's going to encourage that employee to go get that test. If they go get that test and something's detected earlier, then it could be treated earlier.
And on that point, I think
Yeah.
we all agree
Yep.
with the incentivization to make
Yeah.
sure that we get that care. I think we just want to kind of understand a little bit of this carrot and stick approach and how we can actually incentivize some of that care to be more city-bound. Because I'm even thinking about that man or woman that has to leave work and can't afford to take a 40-minute ride to go all the way out to Medina and then have to come back and report back to work or something like that. And I know that people don't always think about those unintended consequences, but it's just stuff that I just want us to think through this and be a little bit more, just understand a little bit better before we just move it through.
And Chair, can I add really quick?
And then I have Councilmember
Okay,
Santana.
and it almost seems like these outside providers should be paying into that platform because we're marketing it for them, but we're paying to bring them more patients. I don't know, that's
Yeah.
a little disconnect.
In Chair, I would just note, I have actually, and I know some of my colleagues disagree, I have no issue with incenting healthcare. I was a supporter of incenting vaccines, Dr. Margolius. However, if we were to incent healthcare, I would put an amendment in the piece required to be a City of Cleveland facility. If we're using City of Cleveland tax dollars to incent healthcare, that's all.
Sure, but just remember, these are not outside providers. I think that might be getting lost a little bit. These are network providers within our plans, MMO and Anthem. So the intent here is not to send them to some random third-party provider. These would be, you're looking at predominantly Cleveland Clinic, University Hospital, Metro, right?
In Chair,
Facilities.
if I may, I appreciate that, understood. The challenge is not in and out of network. The challenge is a lot of our newer hospitals and facilities are outside of the city of Cleveland. And if we are saying that this looks towards newer practices, to me, that draws a direct line. And again, I'm talking about people that work in the city. I don't want to incentivize business to go out of the city, business meaning people seeking health care. And therefore, if I'm a healthcare system and I see a big uptick in Avon Lake and a decline in Euclid Hospital because of people were now inciting people to go to Avon Lake, well, then I'm going to look at a Euclid Hospital and say, I don't need it anymore.
Right.
So and then if that goes away, heaven forbid, then the folks that can't get to Avon Lake are going to suffer the most.
Yeah.
So that's just my point.
I know.
And I think these are all valid points. If we could just get work through this a little bit more, because it may be you have some ideas on how we support city-based providers as well. So just if we could think that through a little bit more, and if you have any other questions for this, please talk to Director Cole. But just want to flesh this out a little bit more if we could.
Sounds good.
All right, thank you.
Thank you.
We're going to hold 1051-2024. Want to get a little bit more background from this as well, okay? All right, that being said, This Committee of Finance, Diversity, Equity, and Inclusion is called to adjourn.